Welcome to the AACS Daily News. The Massachusetts State Senate passed the PACT Act of 2022 on February 10th. The bill aims to curb the rising costs of prescription medications in Massachusetts. We spoke with State Senator Becca Rausch to learn more.
I'm State Senator Becca Rausch. I represent the Norfolk, Bristol, and Middlesex District. I'm currently in my second term. The Senate has been leading for quite some time on comprehensive pharmaceutical cost control legislation. And this PACT Act 2022 builds on the history that we've done in the Senate in a variety of ways. But it's really a comprehensive bill to address the fact that people's pharmaceutical prescription drugs just cost too much. And we've got a lot of work to do to make our medical care more affordable. And this is a really important piece of that puzzle. I have seen both in my family and in constituents' lives all across our district just how unaffordable medical care can be. And that absolutely includes pharmaceutical drugs and the medicines that people need, and particularly medicines for chronic conditions that people will be taking for the rest of their lives. And it's particularly true for folks who are more financially insecure, folks who are on fixed incomes, our Medicare population, right? 65 and older, our older adults. There's a big gap in our Medicare coverage. But a couple of the really big pieces in the bill, one is that patient out-of-pocket costs for insulin would be capped at $25 per 30-day supply, right? Insulin is a really, really critical drug for a lot of people. And so limiting this out-of-pocket cost is a massive step forward to making sure that insulin is affordable. And so this is a really important piece. The bill also helps to ensure that patients can choose whatever pharmacy they want to get their medicines at, right? If you have a particular prescription, you want to go to this particular pharmacy, there are provisions in this bill that help make sure that you can do that. There are other pieces that make sure that patients pay the lowest possible cost when you go to the pharmacy. So that, for example, if you're going to pick up your medicine, you're not going to be charged some kind of cost sharing like a copay or a deductible that actually exceeds the retail price of the drug, which does happen sometimes now. The bill also creates a drug cost assistance trust fund to help people afford prescription drugs to treat certain chronic conditions. There's a licensure process established for entities called pharmacy benefit managers. These are sort of like brokers in the prescription drug market. And there are a number of other transparency and accountability pieces, including some improved healthcare cost trends analyses, administrative review and oversight and analysis from our Center for Health Information and Analysis, the state aid entity, drug price notifications that requires pharmaceuticals to notify the state before they bring new drugs or substantially similar drugs to market, and also before they significantly increase the cost of an existing drug. So lots of really important pieces in this bill. So the Senate passed this legislation overwhelmingly. Only one person voted no. So 39-1 was the final vote in the Senate. We did that just last week. So early February of 2022, the bill is now headed over to the House for their consideration. And I hope that the House will take it up and pass their iteration of a pharmaceutical cost control legislation. If folks are interested in advocating for this legislation to continue to advance, you're welcome to reach out to your state representative or your state senator. Again, we did already take the vote in the state Senate, but we still love to hear from constituents. So reach out. You can find out who your state rep or state senator is on the malegislator.gov. You can plug in your address and find where your state rep and who your state rep and state senator are, and also find our email addresses. They're all on that legislative website, and reach out. And, I certainly host virtual office hours, and I know many of my colleagues do the same thing. So you can even schedule meetings with folks and convey your advocacy that way.